Wits University Virology Professor Shabir Madhi is calling for an end to the COVID-19 lockdown restrictions. He says it's now time to live with the virus. It says pressure mounts on government to lift the state of disaster. Professor Madhi joins me now. Professor Madhi, good evening and thanks for your time. Earlier on in the week, I had a conversation with the DDG of Health and asked this very same question of why the state of disaster is not being lifted. He says they currently do not have the necessary legislation that would enable government to act quickly should we see a fifth wave, a sixth wave of the pandemic. What do you make of that?
Good evening. And I think that really is the crux of the matter, is that do we wait for some sort of eventuality which is completely uncertain and unlikely before we lift the state of disaster, or do we take the latest evidence based on our experience with the Omicron wave to make an informed decision as to the likelihood of experiencing the type of waves that we experienced in 2020 and early 2021, which resulted in large number of deaths occurring. So the most recent experience in South Africa is that during the course of the Omicron wave, which is now subsiding across the country, less than 5% of all of the people that died of COVID-19 since the start of the pandemic occurred during the course of this wave, compared to, as an example, with a Delta variant wave, which was responsible for 50% of all of the deaths that occurred due to COVID-19. So we are in a very different stage of the pandemic. And the reason for that primarily, unfortunately, in South Africa is not because we've been successful in rolling out vaccines, but rather because a large percentage of the population were naturally infected and subsequently developed protection against severe disease. And it is extremely, extremely unlikely, considering what we've experienced with the Omicron wave, that we are going to get other waves that will result in similar sort of number of people ending up in hospital and dying of COVID-19. So I think the notion that we need to wait and see pretty much tells us that we would need to wait and see for years to come, because there's no guarantee, in fact, that we wouldn't have another pandemic in a few years from now. So do we wait and see till the next pandemic arrives or doesn't arrive before we make this decision? And the answer to that clearly is no. So I think government needs to have more oversight, and Parliament in particular needs to have more oversight on the type of approach that we've taken with COVID-19 moving forward. And it's absolutely essential in multiple facets of our life that we get back to a relatively normal lifestyle. And foremost in my mind right now, as an example, is the approach that the Department of Education has taken to continue pretending as if we still got COVID, which is causing large number of hospitalization and death, and having rationalization of when children can attend to school, which is completely unacceptable, and in fact does tremendously more harm than any good by having these sort of restrictions in place.
I think, Professor Madhi, some of the unions would agree with you on that point around the responses of the Education Department. But again, the Health Department says one of the other things that informs their current position in terms of supporting the state of disaster to remain in place is that the take-up of vaccinations has not been at the scale that government would have hoped for. And therefore, that seems to increase the risk and why they seem to be reluctant to go in that direction.
Yeah, so the state of disaster by no stretch of the imagination is going to get more people to be vaccinated. In fact, government needs to take a completely different approach to trying to get more people vaccinated. But the reason why we've experienced such a mild wave relative to what we experienced in the past with Omicron is because a substantial percentage of the population, more than 2/3 of South Africans, were actually infected with SARS-CoV-2 during the course of the first 3 waves. And that natural infection-induced immunity, which has come at tremendous cost, at a loss of close to 290,000 lives in South Africa, that natural infection-induced immunity has resulted in the majority of the population, probably more than 75% with vaccines, that have now got protection against severe disease. So government failed essentially when it came to trying to meet the targets initially of vaccinating 40 million people by the end of 2021 and then revising that to 40 million doses, and it's still nowhere close to that. And the state of disaster is not going to assist to increase the number of people that get vaccinated. That requires a completely different approach, and it requires society to become more trusting of what government is trying to do to get people vaccinated. But the state of disaster simply has got absolutely no role in trying to get more people vaccinated.
Of course, a part of lifting the state of disaster would require an acknowledgement from government that perhaps we have seen the worst of the pandemic. When we see what is happening elsewhere in the world, so in the US, of course, they're going through, quite a significant number of cases due to Omicron. We see the situation in China where lockdowns are still taking place as the variant also goes through parts of that country. Do you think what is happening globally is also informing the decision making?
Yeah, it shouldn't, and we certainly shouldn't be doing those sort of head-to-head comparisons. The main reason being, when the US is reporting 1 million cases per day, the amount of testing they're doing at the time of the peak of the Omicron wave is probably 20 times more than the amount of testing South Africa was doing at the time of the peak of the Omicron wave. When the Omicron wave peaked in South Africa, there weren't 27,000 people that were being infected each day. The figure probably was closer to 250,000 people had we been doing the same amount of testing as the United States. So it's incorrect to be making trying to draw those sort of head-to-head comparisons. And the reason for an increase in hospitalization in the US is not because of people just being admitted for COVID-19. A number of percent, in fact, a high percentage, the most recent estimate is as many as 30 to 40% of the cases that are being diagnosed as being infected with the virus in the US in hospitalized individuals are people that have incidental infection, in that they've been admitted for other reasons, but they end up testing positive for the virus. And that was exactly the case in South Africa at the peak of the Omicron wave. When we were testing pregnant women that were coming into hospital to deliver babies, 1/3 of them were testing positive for the virus. When you talk of China, China has got a different strategy, completely different, which is completely unattainable in South Africa or most other countries. And that is trying to have 0 cases of COVID-19. And China will probably fail in that mission over time. Similar to how Australia has pretty much failed and given up on that sort of a strategy. So I think we need to be guarded in terms of trying to draw these head-to-head comparisons. The South African data, which basically should inform the manner in which we approach the pandemic, needs to inform how we move forward. And that's pretty much what we did with the 4th wave, where government didn't go to higher level of restrictions. Despite an increase in number of cases, many people questioned it, but the basis on which government made a decision was the understanding of the extensive amount of immunity that existed in the country against severe disease, even if that immunity wasn't going to protect against infection and mild disease.
Professor Madhi, let's end it off here. In your view, what is the impact, and in particular, what do we stand to lose if the state of disaster stays in place?
We stand to lose a huge amount, including that it's impacting on society, it's impacting on livelihoods. There's absolutely no oversight of the NCCC and the type of regulations that it comes up with, at times which is completely at odds with science. It allows departments to go ahead and pursue policies which are not necessarily in the interest of South Africans. And again, a good example right now is the Department of Education approach, pretending that COVID-19, the pandemic hasn't changed, South Africans aren't more protected, and keeping children out of school. That comes at a cost. It comes at a cost of impairing the development of children. It comes at a cost of depriving children of nutrition which they get at schools. It comes at a cost of destroying the future, things that cannot be repaired moving forward. So we need to become more reflective of the manner in which we approach the pandemic, knowing that a high percentage of the population, which can be increased with vaccines, are already protected against severe disease.
Professor Shabir Madhi is with the Faculty of Health Sciences at Wits University. Thanks for joining us tonight.